Good evening. It is Monday, December 7th. This is the Guilford Board of Education. We are holding a special meeting tonight so that we can discuss and hear from Dr. Freeman on any updates in the school system regarding COVID-19 impacts. And also we have on the agenda a budget update. Again, this is, we did not meet at the end of November, and our next regular scheduled meeting was not until next Monday. So we did want to give an opportunity for the board to get these updates from Dr. Freeman and for the community to hear these updates. So I'm just going to turn it over to Dr. Freeman and address the first agenda item, which is in fact the budget update.
Thank you, Dr. Balistraci. The budget update I'm hoping will be relatively brief, but I did want to inform the board and the community at large that while we got a late start on this budget build this year, and in several of our most recent meetings, particularly operations meetings, we have sort of held off with budget updates. I do want to say that we have made up that time. At this point, we have held budget meetings with all of our principals and our department heads and have completed all of the location budget reviews. Tomorrow, Mrs. Trudeau and Mr. Bowden have a meeting with Joe Spurgeon and our counterparts on the town side, and we should have firm enough understanding to create budget numbers around medical expenses for next year as well. We've reviewed large areas like athletics and tuition, and we are confident that we will have a complete budget draft completed by the end of this month and ready for submission to the board when we return from the winter break in the beginning of the new year on schedule. Also wanted to note that we have had some meetings in district recently. We are beginning to plan for vaccine distribution here locally for staff members. And with the news that we're seeing around vaccine development and distribution, there was some concern about how we were going to be building this budget and what kind of a school year would we be building for. With the news that we've been hearing around vaccine distribution and the idea that pretty much everybody who wants access to a vaccination should have it by late spring or early summer, I want you to know that the concept behind this budget is being built around a full schedule for next year. We're not carrying over the additional COVID staffing that we put unbudgeted into this budget and building a budget that is based on the extended teaching positions, the extended custodial positions, the extended health aid positions, and all of those other unbudgeted expenses that were built into this budget. Additionally, I do want to note that we will not be looking at large-scale initiatives as part of this budget. Our focus next year will be coming back and not losing ground. So additionally, I've used the example before, there will be no initiative of the scale of full day kindergarten. We will not be adding significant teaching positions. We will not be building large additional positions in around an expensive budget. In addition to the good news around vaccine, we also recognize that there has been economic hardships as in relationship to this budget, and we want the board and the community to know that the administrative team is building a budget that is responsive to those economic hardships as best as possible. Again, all of that being said, the bottom line is we're excited about the opportunity to build a schedule for what could be a school year as close to normal as possible. And that we have made up any lost time from the beginning of this year and will meet the time frame that we published, the calendar that we published around budget build and budget deliberations that we promised the board and the community. I think the first of those items will be an upcoming meeting with the Board of Finance prior to the winter break.
Yeah, so I believe we have a meeting scheduled with the Board of Finance on Monday, December 21st. I will share with Board of Ed members who are newer to this process that typically is a meeting that's held from 6:30 to 7:30 just prior to the Board of Finance meeting, but we will confirm the timing. It is officially a meeting of the Operations Committee of the Board of Education with the Board of Finance, although I think typically all of us who are able to attend have attended. And really it gives us an opportunity to start talking with the Board of Finance about what the administration is thinking about for next year, and gives them an opportunity to ask some probing questions. Another reminder for the viewing public, and you'll hear us say this several times, I think, over the next few weeks, there will be, as we do every year, 2 public forum opportunities on the budget. This will be once the budget has been published in draft form on Monday, January 25th and Tuesday, January 26th. Because of COVID-19 impacts, we will be holding those remotely, but it will enable anyone who wishes to address the Board of Education publicly on this type of forum. That being said, I do want to turn this now over to my colleagues. Does anyone have questions, comments, any other discussion points on this budget? Ted, go ahead.
Dr. Freeman, what assumption are you making about enrollment as you prepare the budget? We had a lot of people who seem to have held back their possibly their kindergarten students this year, and a larger number of people seem to have gone to education at home, et cetera. How have you forecast that for next year?
Thank you, Mr. Sands. We're working with an enrollment projection that is going to be holding close to where we are. We have seen a significant spike in the number of students who are homeschooling this year, but literally many of those communications have told us overtly that that is in response to the pandemic, and those families are looking forward to re-enrolling their students. This year, we enrolled 11 kindergarten sections. We are budgeting next year for 12 kindergarten sections. And this year, some of those sections were fairly small. So we believe that 12 sections next year would accommodate for a little bit of a rebound in kindergarten numbers as well. We do anticipate that some parents may have held students back who would have been old enough to enroll in kindergarten this year, but will be holding off for next year. And as the board knows, the kindergarten number is always the most difficult to predict. There have been other years where we have added a section of kindergarten as late as August. And in fact, one year we added 2 sections of kindergarten as late as August. So the budget will allow for those additions if necessary.
Thank you.
It does assume at least one additional section over what we enrolled this year. So we believe it will account for any sort of rebound.
Other questions, comments?
I should also note that in addition to the operating budget, we do expect to have the capital budget prepared on time as well this year. The board knows that we have been following a 10-year calendar for capital improvements, and the board's also aware that last year we held off on a planned capital improvement for HVAC at Lakes due to difficulty in holding the referendum as a result of the pandemic. So I do want to note that the capital budget will be what was originally planned for this year, as well as the carry forward of the Lakes project. But we'll have that ready, and we'll be prepared to discuss that at both operations meetings as well as the budget proposal. And we've talked about a number of those items at operations individually to date.
Right.
Yeah.
All right, terrific.
And I just want to finish with thanks to Mrs. Trudeau and Mr. Bowden. Again, we made up significant time. We did not begin budget work as early as we normally would have this year. Very much appreciate the work out of the budget office, as well as the work of all of the principals and department heads for getting their budgets prepared, being able to present them thoughtfully and cogently while they were doing all the work that has backed up as a result of the working conditions around the pandemic as well. So lots of appreciation to the whole team for the time that we did make up on this.
Terrific. Thank you. And then I will also just, again, there'll be other opportunities even in this month, but just to remind my colleagues to look at the budget timeline. January is typically a very busy month for us in terms of the budget. So we will have, I believe, a meeting with the district leadership. We will have another meeting with the Board of Finance. Again, we have these two public forums. So just a suggestion, as I did this weekend, to map your own personal calendar against that budget timeline, because it does end up being busy, and we have several extra meetings between the beginning of January through mid-February. If there are no other questions on the budget update, then Dr. Freeman, I'm going to turn it over to you for COVID-19 update.
Thank you again. Yeah, so I do appreciate the opportunity to update the board. It does feel like it's been some time since we've spoken together. I do want to start by going over some numbers. Everybody understands that the numbers around COVID nationally are concerning. Currently, in the state of Connecticut, we reported a daily positivity rate today of 6.6%. And while the numbers in localities lag behind the daily rate a little bit, the latest information we have in Guilford specifically is a few days older than that. But in Guilford, we're tracking a positivity rate of 19.6% with the last available information. In the schools, we at this time are aware of 45 positive cases of students or staff members related to the schools. And that's up from 28 just last week. So from 28 to 45 in the past week. At this point, we know of 413 students who have decided into the full distance learning model. That's 13% of our population. It's up from 11% just before the Thanksgiving holiday, and up from 9% when we opened schools in September. We know that we currently have 74 students who have selected homeschooling this year. That is up from 26 students who made a similar election last year. And again, as I mentioned earlier, many of those parents have cited the pandemic as a reason for them choosing homeschooling.
Dr. Freeman, I'm so sorry. Can I interrupt you very briefly? Can you clarify 45 students to date that have been tested positive
Yes.
for COVID, not 45 students presently positive?
That's exactly right. Yes, yes.
Thank you.
Many of those 45 have gone through their 10-day cycle. Yes, it is a total of 45 students or staff members. That's 45 individuals who have had positive identifications at some point during this school year, not current. We have seen, and I think the community is aware of this, we've seen increasing numbers of students and staff members who have undergone quarantine as a result of those positive identifications that are coming into our schools. However, what is important, and I think that I think residents are hearing this message at the state level, and in fact, nationally, it's been interesting to follow the research around this. To date, we are very confident that we don't believe any of those positive cases were transmitted in the school. Of those 45 cases, we know fairly confidently that 44 of them did not contract the illness, the infection in our schools. Contact tracing indicates to us that the infection came from outside of the schools. There's one case where where we're not clear. We can't clearly identify where we believe the infection came from. Across the country, we are hearing that schools may in fact be some of the safest places where students are spending their time. Governor Lamont has been very clear that he believes that the schools are some of the safest places that students are spending their time. What we are finding is that when a student or a staff member is identified as being positive for COVID, the mitigation strategies that we have in place in our schools, the smaller class sizes that we worked to create this year, the cohorting that we have in place, the distancing that we attempt to maintain in the buildings during passing time, during lunchtime, and even in the classroom settings, the plexiglass and plastic dividers that we have installed in many locations, and most importantly, masking that we are really strictly following. When a student is identified as positive and comes into our school, those other mitigating strategies are keeping the students from transmitting the infection in school. Equally as importantly, maybe more importantly, because of the partnership of the parents, we are identifying those positive cases really, really quickly. Parents are sharing with us immediately when they receive that positive notification. Many parents are keeping their students home prior to the positive the confirmation of positivity. And when we find out about anybody in the school, staff member or student who is positive, we respond quickly, and we respond by isolating that individual, and then that individual goes through quarantine. I think that the community as well is aware of the fact that we have done well compartmentalizing. We have, early in the pandemic, had individual students who were quarantined as a result of exposure to the students. We've had many cases where we have had classrooms that have quarantined as a result. And what is happening is that as a result of those quarantines, we're beginning to see cascading effects that are impacting staffing. One child, one positive student, one positive staff member can have multiple staff members who are required to quarantine. So we've also seen situations where an entire grade level wasn't placed under quarantine, but did shift to distance learning for the 14-day period. At our middle schools, we've seen situations where entire teams shifted to distance learning to accommodate that 14-day period. And most recently, we've seen an entire school in the system. We've seen Adams need to shift to distance learning for all because of the impacts that quarantines had on staffing levels. What that is affording us, however, is the ability to compartmentalize and shift a portion of the district to that distance learning, which keeps those infections from spreading within the schools. So while we are experiencing a 19.6 positivity rate in the community, I would argue that we're not experiencing that high of a positivity rate in the schools because of the way that we are able to respond. Interestingly, in California, just this weekend, the entire state is now under stay-at-home orders, but the schools are remaining open for exactly the same logic that I'm discussing here. With the homeschooling numbers increasing and with the numbers of students who are moving into fully distance model up to 13% from the 9% where we started, I want to remind the community that we still have choice that is available. So with the choice to be fully distanced, with the mitigation strategies that we have in place, and with quarantining, fairly aggressive quarantining that we're putting into place around the identified cases, to me, what this says is that it allows us to keep the schools open for the families who want or need their students to be in schools. We realize it's not happening without impact. We realize that having to having to shift Adams to distance learning for 4 days had impact on families. We realize that having to shift a full grade level had impact. But we're really pleased with the fact that we are keeping a safe environment and that we have been able to date to keep the schools open under this model. We're continuing to work very closely with the local health authorities. The local health director continues to feel confident in the safety that the schools are affording, working under these conditions. That's really the update. I wanted to make sure that the community had an opportunity to hear that. We remain enormously confident that we're providing a healthy environment where we are not transmitting the infection within the schools, not between and among the adults, the staff members in the buildings, not between and among the students who are coming into the building. And a lot of that has to do, again, with the partnership we're receiving with the community. Parents have listened and have responded really appropriately to the request that if your child has symptoms, that you not send them to school, that if you're waiting for a test result, you not send your child to school. And then again, I know the enormous impact that a quarantine has on individuals and families, but the parents are absolutely partnering with us. And when that has to be done, they're doing that well. And it's allowing us to keep the schools open for the majority of our student population. And with that, Dr. Balistraci, I assume there's going to be a lot of questions and conversation.
Yeah, no, well, thank you so much. So I now want to open it to board members who have questions, comments. Amy, go ahead.
So I just probably not a question that other people would want to ask as well, but with the guidelines from the CDC changing in the last week or so with the 7 and 10 day quarantine options, are we planning to adjust to those changes?
Only if and only after the state adjusts. At this point, the state has not responded to those changing CDC guidelines. I know that the state is looking at them and discussing them, but until the state makes changes in their recommendation and then our local authorities follow through. So at this point, we continue to follow the guidance of the local authorities who continue to follow the guidance at the Connecticut state level. And while I know they're looking at the changed CDC guidelines, they haven't made an update as of earlier today. I understand the way the CDC has changed, but I also get a little concerned that we will now have quarantines of even more variable durations, which I think is going to become even more confusing for the community. So my understanding of the new guidelines is that it could be as short as 7 days with a negative test, as long as 14 days still if there are symptoms, and then a possible 10-day without a test and without symptoms. And so I do get a little concerned about messaging and consistency. It's already a little confusing in that somebody who is considered a close contact quarantines for 14 days, but somebody who is themselves positive only quarantines for 10 days. We've been at some pains to try to communicate that clearly, but we'll keep following the conversation at the state level.
Others. John, go ahead.
Dr. Freeman, in your budget update, you spoke a little bit about a vaccination plan. I'm wondering if you could speak to that a little bit for the GPS staff and what that might look like.
So my understanding of the way Connecticut will roll out the vaccine plan is that the 2 populations identified for the immediate rollout will first be individuals who are residing in long-term care facilities, and then it will go to essentially frontline workers, which I believe has been broken into multiple tiers. There are going to be hospital and medical workers. There are going to be EMT and emergency response workers. And then in a 3rd tier will be teachers and municipal workers. And so we are trying to be ahead of the curve. We're cooperating with the town, with the local fire department, and again with our health director to make sure that we understand what our responsibilities will be and what ways we can facilitate that distribution to municipal workers, including the teachers, when we have the opportunity to roll that out. I appreciate the question because it's worth noting for the community that if necessary, we will be willing and ready to shift to even 1 or 2 or 3 days of distance learning if it will facilitate a quick and efficient rollout of the vaccine to the teachers who are working in the schools so that we can get that out as quickly and efficiently as possible. And again, we're still developing more information on that front, but we just want to be ready to distribute that as quickly and efficiently as possible as soon as we have the opportunity. And then more broadly, my understanding again continues to be that by late spring or early summer, the vaccine will have been made available to anybody who wants the vaccine, which is the hope for coming back next school year with close to a normal school schedule, class sizes, and school year.
Other questions? Moira, go ahead.
Katie. Paul, you probably can't speak to this yet, but it's kind of a national conversation, more along healthcare workers, but I know in some school districts across the country about, will there be a requirement to get the vaccine, for staff and yourselves and things like that? I mean, I don't think it's something we can answer, and I don't know if it would even ever come to pass that way, but is there any thought or conversation about that, or even on the state level?
A lot of conversation about it. At this point, my understanding that it will not be a requirement, but that everybody will be strongly encouraged to participate. Again, you're right. It's a conversation that we're following, and I'm not really in a position to say it it would be very unlikely that we have the ability to make a local decision either way. If it's going to be required of students, it would be a state level requirement, like the other school vaccinations are required. My understanding at this point is that it will likely not be a requirement.
Okay, thanks.
We'll keep you informed. I'm sure there'll be a lot more on that topic. It is a conversation, it's a question that's being asked every time I'm in a discussion or a meeting about vaccinations.
Ted, go ahead.
How do our numbers in terms of people who have tested positive in the system compare to some of the adjoining districts?
It's a good question, Mr. Sands. I think I'd actually have to do a little research. I think ours are, again, I think ours are relatively positive, but I'd have to look. I thought you were going to ask about our enrollment numbers around things like fully remote. I will look into the question about our case numbers. What I can tell you, I'll answer the other question, the one I thought you were going to ask. We're still tracking at about 13% of students who are at fully remote. I'm aware of some districts that are as high as 40% student population in the fully remote model. To me, what that communicates is that our students are benefiting from being in schools, that the students feel comfortable, and that the town feels confident in having students in the buildings. We'll get back to you on how our numbers compare to other neighboring districts. If you look at the community map, you will see that most of Connecticut is red and Guilford is red, just like all of the other shoreline communities. But I'll look more specifically for school numbers. It's also worth maybe explaining at this point, I shared tonight that we've had 45 positive cases since the beginning of the school year. Anybody who's been keeping count is aware that we haven't sent 45 notices to the community of positive cases. I think it's worth explaining. In many of those 45 cases, we knew immediately that there was no possibility of exposure in the schools because the student or the individual who was identified as positive had already not been in school for a period of time that was greater than 2 days. The notices that we send home when we identify positive cases are only sent when that positivity will require students or other staff members to be contacted by contact tracers. When we are going to begin making phone calls and when other individuals are likely going to be identified as close contacts and therefore placed under quarantine, we are informing the individuals, the school, and the community because of those communications. When the individual is told by their doctor or by the health director that they need to quarantine and nobody else is impacted because of confidentiality standards, we're not sending notifications out every time we get informed of one of those positive cases that doesn't have an impact to other people as close contacts. So I do want to make that clarification. We know of every case, we know of 45 identified positive cases. We haven't sent out 45 communications to the community to date.
Dr. Freeman, I had a question. We had, as you noted, running around 11% of our student population prior to Thanksgiving or therearound who has been fully remote. And then you noted over the last couple of weeks an increase to approximately 13%. Do you have any sense of whether that is a temporary trend that might reverse itself post-January, or have parents informed kind of a plans of a temporary between holiday remote, or is there simply no way to predict what that looks like?
Anecdotally, I think you're exactly right. Anecdotally, a number of parents indicated to us that they were going to be doing this for some period of time following the Thanksgiving Day break. Some parents indicated 2 weeks. Some parents indicated through the entire holiday season. So all we have is that anecdotal basis to go on. But I do believe it is a combination of watching increasing numbers at the state and national level and concern around holidays. And so I do believe that anecdotally, the increase is a result of those two factors.
All right. And then I have another completely different question coming out of the Board of Finance meeting, a question that was asked of me that I could partially answer, but thought I'd bring here as well, which is question around the tents and the tents at each school. How are they being used in a continuing fashion? You know, certainly I know from things you've reported, it has allowed, for instance, at the high school, you know, the band to really spread out and practice. It is my understanding that it has allowed teachers to use that space at times for various activities. But again, a question that was posed by a Board of Finance member, I was hoping you could provide a better answer than I was able to provide.
I'm happy to. They continue to be used flexibly. They've been assigned to each building and they are at the discretion of each principal. Initially, they were being used as additional outdoor space, even in rainy weather. I believe as the weather turns colder, what is happening is that we have closed the sides and now they can more appropriately be considered additional large indoor spaces. So in many places, they're being used in the same ways that the gymnasium or the cafeteria might be used for students to move to a larger space, even if the walls are closed, because it's a larger space that involves more social distancing and could allow for students to take their mask breaks in such a setting where they can get further apart, more socially distanced. They continue to be used for class activities that might require greater amounts of social distancing, as you referenced at the high school for some of the music classes. And in one specific case at the high school, one of the two tents at the high school now does have heat available, and it is being considered an indoor space, but it is a space that is expanding the commons and allowing us greater separation, greater social distancing during the lunch waves. And so that it does have indoor furniture that's out there now, but again, it allows us to get more space in between each of the tables, and almost all of the tables at the high school for those lunch waves now have plexiglass dividers as well. So students are sitting at tables, but the tables have plexiglass dividers keeping them separated from each other, and the tables have more space in between them because students need to take their masks off to be able to eat lunch. So, you know, again, it could be for any of those spaces. The benefit to the tents that we purchased is that the siding is available. So again, in many other surrounding districts where they're simply going to have to stop using the tents during really cold weather because it's just a top, ours with the sides can continue to be used, but we have to think of them more as indoor space, additional indoor space, not as covered outdoor space.
All right. Thank you. Other questions, thoughts? Anybody? Go ahead, Amy.
So this question has a lot of ifs and also a lot of optimism. But if, you know, vaccine rollout is good in the community and we have the appropriate number of doses going forward, and if we have a turnaround of things in late January, early February, it went very smoothly it seemed to me, for the K through 6 transitioning back to 4 days. Are we in a good position to move 7 through 12 back to a 4-day if the numbers work?
Yes, we continue to maintain the possibility of transitioning back up to 4 days or even 5 days a week at the elementary and at the middle and high school level at Adams and the high school. You know, again, we were hopeful for an October 19th transition to 4 days a week for all. The goal is to be back to 5 days a week for all before the end of this school year. And as you pointed out, it's just going to be contingent upon local conditions. But yes, we maintain that optimism. The answer is yes, and yes, and yes, if all things fall into place properly. Dr. Balistraci, the other thing that I did want to note, you know, the conversation that we've been having so far is about decision-making that is based strictly upon the numbers and the virus itself and the spread of the virus. I do want to sort of make sure that I'm clear. In a couple of cases already, particularly at one grade level, at the elementary level, and at Adams in some of the teams, what has been happening in our experience and what is likely to continue happening is that the quarantines that we are putting in place around positive cases, that's what's allowing us to prevent the spread. But as we have multiple positive cases in individual buildings and multiple quarantines occurring at individual buildings, while that is, I continue to believe, medically the right thing to do, that is continuing to put pressure on our staffing. And so what is happening is that as we begin to see increasing numbers of students who are quarantined, for instance, again, at one grade level, we had one class that was quarantined. But as a result, we had to put the entire grade level into a distance learning position because other teachers at that grade level were impacted by the quarantine as well. And so we saw that happen with teams at the middle level. And then most recently, we saw that happen with all of Adams. I do believe that before we see a positive turnaround, and as we continue to go through what's going by all projections to be a couple difficult months, I do believe that we will continue to see staffing challenges that may continue to result not in greater numbers of students being quarantined, but greater numbers of students needing to go into a 2-week at-home distance learning format while we get staff members through a quarantine and then back into the building. I think it will continue to be likely that we'll see more grade levels going out, more middle school teams going out, possibly whole schools, again, like Adams, going out. And I do just want to caution the community, it may get to a point that the entire district has to move into a distance learning structure in order to make sure that we're staffing at a level that is safe. I believe that we've got distance learning in a place where much of the learning can continue through the distance format, but I just want to make sure that everybody is aware. We may continue to see expanding closures because of the impacts that the quarantines are. Now, the quarantines are keeping us all safe, but they put an enormous stress on our ability to staff the buildings properly. And so we may continue to see 1 or 2 buildings that are in a distance model while all the other buildings are open, or worst case scenario, a district-wide closing if the staffing becomes that problematic.
And Dr. Freeman, at a meeting I was recently at, I was asked, is that because we don't have enough substitute teachers? And my response was that, in fact, we had increased the number of building subs, long-term subs, but that it is simply not a match for the extent that a quarantine decision has in terms of the number of staff that have to be sent home for periods of time.
That's exactly right. The state's been experiencing a shortage in substitutes since before the pandemic hit. During the pandemic, we are experiencing a shortage of substitutes all over. We have, at the beginning of this school year, we increased the number of permanent subs that we have. We've got substitutes in every building that we have report on a regular daily basis. We doubled that number from pre-pandemic to the pandemic for this year. We have expanded our calls to increase the numbers of daily subs that we bring in, and we are currently taking advantage of the governor's executive order 90, if you can believe it, that waives the requirement for a bachelor's degree. We now have the opportunity to bring in substitute teachers who do not hold bachelor's degrees, and we are looking to take advantage of that. We still had to close all of Adams because even with all of those opportunities and increases, we were not able to cover the absences that we were experiencing. And it's also worth noting a bit of the complication here. When a teacher is under quarantine, but we are able to keep bringing the students into school, that teacher has some ability to maybe teach from home. So we still have distance learning going on, but we still need to place a physical person in the classroom for physical supervision. So it's actually taking 2 people. If we shifted all of the students that teacher works with to full distance learning, now that teacher is able to meet all of those instructional requirements without the requirement of that second person. So it's not just the numbers of coverage that we're requiring when teachers are being subject to quarantining. And again, this is not because those teachers are all positive. It's out of caution that people are quarantining. But it's also because the distance learning model in some cases sort of requires both the teacher to continue teaching from home and that local additional supervision. And so it just has a significant impact on our ability to staff. We've also had substitutes who have needed to quarantine because our substitutes have been identified as close contacts to somebody who may have been in the building after being identified as positive. And so we're just seeing cascades that are happening. And it will be challenging to continue to be able to staff, I believe, as we move through December and January of this winter.
Mr. Sands, did you have a question before?
It was about substitutes, so you covered it, Katie.
Okay. Other questions, comments, discussion points from board members or others?
The only piece that I'd like to make sure that I get in there, again, on the budget piece where we ended with kudos, I again just have to say, I cannot tell you how appreciative I am of the work that the teachers are doing. The teachers who are working in these conditions right now are absolutely doing God's work. They're coming into school every day. They are redesigning every lesson that they've ever presented in a way that is supporting students both physically with them and working from home remotely. Remember, even in the settings where we're open fully 4 days a week, K through 6, we now have 13% of our population who are staying at home, and students who are under quarantine, and students who are just out sick who now are continuing to log on and be part of those classes. And remember, the teachers are doing this in conditions where they're wearing masks and they've got plexiglass dividers around them, and they're dealing with their own nerves in the face of this pandemic and these rising numbers as well. I just have to thank again every teacher in Guilford schools for allowing us to keep meeting the needs of the kids. Kids need to be in school. If we can reduce activities in bars and gyms and restaurants to be able to keep our schools open, if I can continue to ask community members to restrict their activities outside of school, to be masked when you're outside of school so that we can keep the schools open under these conditions, just absolutely want to continue making that request because schools are important. Our kids need to be in schools. The teachers deserve an enormous amount of credit from all of us for the work that they're doing in keeping those schools open. And I ask the community to keep allowing that to happen.
100% behind that statement for sure. And additionally to the district leadership team who is leading the teachers and responding every time there's a positive case in their building and having to jump into action, as well as just really guiding our staff, our students, our faculty through all this. It's really, really tremendous. While we're on shout outs, I also just wanted to take a moment. I had the opportunity to say this at another meeting as well. We are really so grateful for the public health director and the contact tracing folks in town who we need to respond really quickly as a school system because what they learn when they're doing contact tracing and the decisions they make impact what we need to do sometimes within 12 hours or 24 hours in terms of decisions around who comes to school, what schools remain open, what classrooms remain open, and what folks we have to send home. And so it really is a tremendous effort they're doing to help support us as well. Just want to give a last opportunity if anyone has further comments or questions for Dr. Freeman or anyone else in this discussion? Seeing none, I really want to thank everyone for being open to this special meeting tonight. I think it did give us an opportunity to hear some really important updates, particularly after the Thanksgiving holiday, given the rate of transmission we're experiencing in our communities and concerns there may be around that. We will be having our regular Board of Ed meeting next Monday, December 14th at 7:30. It will be preceded by our Operations Committee meeting at 6. And then again, we will have the Joint Board of Finance, Board of Ed first budget information meeting on Monday, December 21st. So I want to thank everyone for joining us tonight. I will entertain a motion to adjourn the meeting. Mr. Sands, the second. Mrs. Sullivan, all in favor? Aye. Again, thank you everyone for joining us. Continue to stay safe, please. And we will see you next Monday night.